Hello, and welcome to episode 4 of the No Normal Show. Today's Thursday, July 16th, and this is brought to you by Revive Health. This is our weekly deep dive into how hospitals and health system marketers can navigate what we call the no normal. I'm Lindsay Thompson, head of communications at Revive Health, and your guest host for the show. And I'm joined by Jalissa, our show's producer. Hi, Jalissa.
Hello.
We are really excited because we're joined today by Dr. Francoise Adan, who is the director of the University Hospital's Connor Integrated Health Network based in Cleveland. Through her commitment to self-care, stress management, and resilience, Dr. Adan inspires patients, employees, and communities to achieve optimal health and well-being, regardless of the presence or absence of disease. Dr. Adan launched and oversees UH for You, a program designed to provide practical, compassionate, and helpful support for UH's 28,000 employees in the wake of COVID-19. Hi, Dr. Adan.
Hi, how are you?
Doing well, thanks. Great
Glad to be with you.
So just some quick notes before we dive in. If you're new and wondering what new normal means, essentially any kind of new normal is just thrown right out the window. We're likely living in a state of no normal for months or even years. And as hospital and health system marketers, we have to learn how to adapt and succeed despite this uncertainty. That's what this show is about. If you want more information that deep dives into the dynamics of the no normal, please check out our first episode of this podcast featuring Chris Bevelo, or read the blog posts that we have on our website. In this podcast, we'll be sharing industry trends, research, and stories to help health system marketers navigate the no normal successfully. And you can use the question queue, that button that you see in Zoom, to submit any questions that you might have along the way, and we'll protect some time to address those. And you can subscribe on iTunes or wherever you listen to podcasts for more episodes of this show. So today's show focuses on employee communications, and it's really designed to share practical learnings to help improve the support offered to a system's workforce and really help mental health be a priority within internal communications, especially during this time. So Dr. Adan, would love to know from you even first, what are some of the ways that UH and the UH for You program has offered support to employees throughout the pandemic?
Certainly. So I love the title, by the way, No Normal. I think that's very clever. So we responded about 2 weeks after the initial attack, so to speak, from COVID-19, and created a new initiative called UH for You, leverage the existing resources, and then adding some additional services. This was really in response to the clear evidence that we needed to support the emotional and non-physical, so to speak, needs of our employees. So, and the tone of the communication was important. You know, instead of those emails that we were receiving appropriately, but telling us emergency type of procedures and adaptation that we had to make from a clinical point of view, this was really a much more supportive, kind, empathic, compassionate message. So we developed different arms. One was a call center where people could call to access resources as well as having support. Two, a digital library of resources ranging from childcare information to food insecurity information and covering, you know, resilience tips and much more. Three, an online webinar and classes free to employees, meditation class, yoga class, nutrition class, and so forth, that people could access no matter where they were. For a crisis intervention team, we train about 50 of our employees to really be ready to be deployed should the need be there. For making sure that we had also what we call lavender rooms. So those are rooms where people can take a breathe and have some rest. We put some comfortable chair, aromatherapy, and guided imagery apps. And then lastly, and we're still doing that, and it's one of the emails that is most open daily, we send a daily email to all 28 employees with one tip, how to practice gratitude, for example, to a practical resource, food bank opening and where, and then some uplifting either quote or selfies that our employees are taking up themselves or something like that. So, and we have been doing that since, I think we started that at the end of March.
Oh, that's fantastic. And before we went on air, we were talking about the really unique needs of frontline workers and especially physicians in terms of mental health, some of the stigma, the reticence to even access and seek the support that they know is out there. Could you speak a little bit about that to maybe contextualize how important these resources are?
So, what we do is really building resilience, right? Building resilience, offering room to have support, unconditional. This is not connected to EAP or HR. It's kind of a neutral place. And we also offer a lot of practical resources. But we're focusing on prevention and support. Now, I think that it's important to really model and making sure that there is a buy-in from the top, using those services, talking about those services, practicing those resources, and that is crucial. Now, if there is a sense of needed additional help and that we're switching from resilience building and what we would consider a normal reaction to an abnormal event, and people might need assistance for behavioral health, then we would make a referral to EAP or to mental health. And I think that because the entrance is through this resilience, support, not judgmental kind of gateway, I think that it has helped with breaking some of the barriers.
Wonderful. And are there any other tips that you can share that UH has taken to help improve the access and awareness of all of the resources that you listed that you offered about 2 weeks after COVID hit?
So certainly, we and we're still learning from it as well. So we know that not all our employees have access to a computer and not to specifically a UH computer. So we have great resources, but a lot of them are only accessible digitally. And then we have the email that is also coming digitally. Now the emails that we're talking about, it is short enough that it can be printed and post anywhere. It can also be shared by supervisor or manager hurdles, and we have heard that that's what they do. So change of shift, either from our nurses as well as our cooking and cleaning crew, when the printing those emails have been really an effective way to making sure that people have access to information. But I think that is crucial to make sure that we are reaching everyone, right? And often the people that who need the most, we don't reach them. So that is to be intentional, and we need to be creative to make sure that and we reach them, and we certainly learn from that. I think that as I mentioned before, the tone of the emails for you, this is particularly relevant for this audience, and we are actually working with our communication, internal communication specialist who, we offer the content, but they modified and they work hard on making the the tone very specific. And modeling, how we talk about that, I think that it's making sure that you have a bilateral information. So that's why we created the call center, where people call and report what is the issues. And we have been documenting to know what is particularly challenging to them, and, you know, expecting as we are going to evolve to possibly another surge, we'll hear from them again to what's more important at that time.
And have you seen some of these concerns change over time? So whether it's, you know, when the wave one first hit versus, you know, seeing some schools, you know, whether they come back online and in a live way or not, you know, so some new trends emerge as this has gone on?
Yeah, so initially a lot of it was safety. You know, do I have enough PPE? And afraid of contaminating not the family, and just making sure that that was really the stress, and is it safe to go back to work? That was a big concern. Financial certainly was a concern as well, afraid of losing their job, and you know, real fears. And now I think that the concern has switched to more long-term consequences. How do you work from home for, you know, time being, and how do you work not only from home, but how do you work effectively from home? How do you deal with the isolation, the loneliness? Practical questions about, you know, people who have children and who are right now negotiating and thinking about, should they hire childcare, are the kids going back to school, what kind of plan do we make, and most likely we're going to need to recalculate anyhow. So the shift has, the concerns have shifted a little bit.
Yeah. And I imagine there's one other kind of cultural force that we haven't talked about outside of COVID, which is the Black Lives Matter, some racial injustice movement that's happening. Cleveland is a very diverse community. Can you talk about, you know, how that has layered over and maybe also impacted UH's workforce and mental health?
Certainly. I mean, that has obviously, like, you know, it has accelerated, I say, and put the spotlight on the, you know, to me, I think that, let's talk about COVID first, has really accelerated the commitment to resilience and self-care, you know, and not only for our employees, but really for everyone, for humanity. How do we deal with this, and how do we continue to run this marathon? Then you add the racism and disparity issues and violence issues, and I think that it has made it non-negotiable as well to really be brave enough to look at how do we contribute to the problem, but as well as being, you know, focusing on how do we contribute to the solution. So somehow I find myself in the task force of social justice and equity, and we are using the UH4U communication to promote some messages, and as we are building some education material and having an intentional change and adjustment within our organization, we will use this type of communication coming and sharing that with our employees as well.
That's great. And what are some of the things that you're hearing from employees related to Black Lives Matter, and especially as you've been using the UH4U program to canvass or to solicit and show support?
You know, I'm going to say that the objective of UH4U is certainly, again, it's provide compassionate support and practical tips. So you can call for any kind of reason, and that's what we are here for. If we have a sense that there is, a need, or the person asks for additional mental health or behavioral health support or chemical dependency support, we will refer to EAP and to our colleagues for behavioral health. I'm certainly not going to pretend that UH4U is the solution for the racism and disparity we have in our world, but I think it can help with communication and support. So, what I hear from is that people are tired, people are fatigued physically and mentally, and at the same time, people are still incredibly committed to do the right thing, to support each other, to support, of course, our patients, and are very mission oriented. So, as we talk about that a little bit offline, I think that people who work in healthcare are, naturally givers and compassionate and empathic. And so they are trained, and they are almost wired to do that naturally. And in the meantime, certainly not perfect. And I think that where we, because I'm certainly one of them, can use some improvement is take better care of ourselves and have that, commitment.
And you mentioned self-care and willingness to do so, or overcoming some of the stigma and the barriers. And along with being incredibly compassionate, I think there's, especially frontline workers, a lot of a sense of perfectionism, or there might be the stigma. Could you talk a little bit about that and just some of the really unique interpersonal dynamics that come with a physician? And, even before COVID, I was looking at some of the data, and we were looking at, even in 2019 and 2018, some pretty impressive levels of burnout among the profession. And so, what does that mind space look like, and how might that be compounded by COVID?
You're absolutely right. So before COVID, the rate of burnout for the medical profession is about 50%. It's about the same number for nurses. And so it's not, that I think that it's across many healthcare providers. And, there are things that are, there are system issues as well as personal issues, right? And there are things that we cannot control. So let's say that, you don't like electronic medical records. Well, sorry, you're still going to need to use it. But there are things that are in your control and that you can do something about it. And so, we need to focus on both improving the electronic medical records from a system point of view, and then encourage, support, model. I cannot insist enough on what does that mean, self-care. And a lot of people think that self-care is indulgence. It's like going into a retreat. But self-care really means that I'm paying attention to my needs. So I'm going to rest if I'm fatigued. I'm going to make sure that I have adequate sleep and adequate nutrition, and even stay hydrated. And we hear sometimes that some clinicians skip meals and go hours without even refill on water. And so those really basic needs are even compromised, which makes things certainly worse. I think that traditionally, we know that healthcare providers don't like to ask for help, and they forget that we need to put the oxygen mask on us first before attending the need to some, of others. And I'm always, I always smile when we hear that, how many hundreds of times have we heard that, and they keep saying it, right? And they say it for a reason, because it's true. So, you know, if I want to be the best I can be as a woman, as a mother, as a friend, as a clinician, as a leader, I know that I need to take care of myself. And we, you know, I think that for people who are listening, they have an opportunity to possibly break the stigma and encourage a different type of communication, maybe a little bit more genuine, and where vulnerability is not only accepted but actually rewarded and not, you know, compromised or punished. So, you know, there's all kids look at us, and you know, or you know, as an employee, I certainly look at my leadership and see what they're doing, and it's important to all of us that we model healthy behavior, but also self-care.
Yeah. You talk about vulnerability and modeling, which are incredibly important. What are some of the ways or examples practically that we can work with our health systems leadership to model some of these behaviors, or even at a people manager level, how we can be proponents of the types of things that make it okay, that break that stigma?
You know, I think that I always focus on prevention and building resilience. So, you know, those are evidence-based modalities. I mean, meditation, exercise, yoga, healthy nutrition. Those are evidence-based modalities that shows not only that it builds your resilience, it's helped to decrease the impact of stress, and has many advantages from a clinical point of view. So making sure that those things are available, easy to access, free. We do a lot of I will put parentheses, we do a lot of chair massage and a lot of services to our employees to really making sure that they understand we value them, we honor them, and we are extending, you know, support and help as much as we can. Now, I think that in terms of communication, I think that telling stories, and, you know, I think that the stories of how we build resilience, or how we face adversity, and how we conquer adversity is usually because we have the help of each other, we take care of each other, we take care of ourselves, and having the, you know, a different way to tell a story. There is certainly an opportunity to decrease the stigma and encourage people to ask for help, and not judging that, but actually, or it's judging that as an act of courage. And you know.
Absolutely. And as we're, you know, moving through different periods of the pandemic and looking at surges in states, seeing predictions, you know, around the nation, is there anything that we need to do with our employee engagement, with our support programs, to flex and morph to meet some of these new rising needs again?
The most important thing is making sure that we listen to them and we hear them. You know, what do they need, and validate their fears and their concern before we even offer solutions. We just, you know, so I think that the first step is to make sure that we hear them, we listen to them. We not only, you know, provide classes and do town hall where I'm communicating to you all, but I need to hear from you what's really going on. I gave you an example where we realized, this was at the beginning, that some of our employees were concerned that public transportation might be not running as smooth as usually, and therefore they were concerned about possibly arriving late at work. and possibly being penalized for that. So, you know, this is something that I have to say, I drive a car, I work remotely a lot. I have not thought about that. I don't take public transportation here in Cleveland. So to be alert of that concern, help us to make sure that this was not going to be an issue and that we heard them and, you know, we relax a little bit our arrival on time policy and making sure that people felt heard. It was so simple to do, but if you don't listen, you would not know about that problem. So I think the first thing is to listen and making sure that people can leave messages, send emails. The call center that I mentioned before had also email set up, and some people were just preferring to reach out to emails and leaving, you know, concern or questions about their issues. Yeah, so that's the first thing. In terms of, I think that it's always important to think about prevention and building resilience and normalizing a lot of those things that we are going through. Right now, just about all of us have some fears, have gone through some losses, so feel some sadness, are fatigued, certainly physically, most of the time mentally. And, you know, it's validate, but also normalize those type of feelings. And then there is a range between the feelings that we all have. I mean, I often feel like I'm on a roller coaster of emotions, right? I mean, I can be energized and 2 hours later in panic, and then half an hour later exhausted, and then we start all over again. And this is what I do for a living. You know, I'm a stress management guru, and I still go to the roller coaster. So I think normalizing this is important, but then making sure that if people cross the line of being impaired by those symptoms and fall in the category of pathology, we provide services quickly and are very responsive. So we need to do both. We need to support everyone and focusing on prevention and make sure that, you know, we increase access and rapid access to people who need help.
And you've said that. I want to clue into the importance of speed and rapidity. Can you talk a little bit about that as a factor in being able to provide employees help when and where they need it?
You say speed?
Yeah. So the important, you know, is it very important? Is that one of the critical factors of, you know, when an employee raises a concern, to be able to have a fast answer, a way to address that concern?
Yeah, yes, I think that, you know, you would not absolutely make sure that you don't always have a solution. I think that, you know, the response, the attentiveness, I heard you, needs to be as immediate as possible. The solution might take a little bit, you know, of a while, depending what the issue is. But I think that at least to know that, hey, I got you. I'm holding your hand. Literally, the image we had when people were calling the call center was, you are holding the hand of a family member, your UH family, and you're not letting it go until you find a solution, or, you know, making sure that we communicate clearly when and how we are going to communicate back. And concern were, again, ranging from concern of childcare, food insecurity, legal documents. I mean, we just heard a lot of different things. And I think that maybe it's something that was not clear enough. I think that having resources, so, you know, when you are stressed and fatigued, and on top of it, you're dealing with your family, your loved ones who are probably as stressed and as fatigued as you are, having your employer really partner with you to find some solutions is crucial. So I'm not telling you, hey, look there is some solution of childcare. No, it's like, I'm going to find the best childcare for you, depending where you live, how old are your kids, what your shift. I'm going to work with you. I'm not telling you, hey, go look page 23 of the manual. I'm doing that for you.
I think that's really critical, and the notion of just acknowledging as fast as you can. You might not have the answer. As communications professionals, we often want to gather the helpful information and then deliver it, which could take some time. And what I'm hearing is it's really, really important to signal recall right away. Say, this matters to us, I'm on it. And you might not have the answer or, you know, the resource that they're looking for, but establishing a relationship right off the bat is critical. We do have a couple of questions. So first, what is the best medium of communication to deliver messages to staff on the topic of self-care? And I'll merge it with another question that also asked about, you know, communications tools. Is one more effective than the other in the way of email, intranet, text, newsletters, etc.?
I think that we cannot have one answer. I think that we need to do it all, and it really depends. I mean, certainly all of us are reporting email fatigue, and we have even more emails, if it's even possible, than before. So to make sure, you know, the email that we send daily is very, very short and very different than any other emails that people are receiving. And we work hard to try to avoid silos and repetitions. So, you know, it's a very different email that it will be obvious. If it was colored, you know, it would be a different colored. It's obvious what it is, and it's very different. And it's delivered early in the morning, so it can be printed, posted, shared, and used during supervisor meetings or managers meetings with their staff. So I think that we also have done, you know, town hall. We have done a lot of webinar and Zoom of all sorts to teach meditations, and we have YouTube videos and that are recorded, but people actually like the live sessions. And, you know, we also have QR code for meditation. It's been kind of top down, but also lateral. So it started with the senior leadership team. We have, you know, the top 150, the team, everybody was aware, kind of going down, either words, emails, modeling, telling your story. Hey, you know what? I'm going to this yoga class, 20 minutes at noon. It's so good. And then it percolated like that. So I don't think there is one that we should focus on only one communication. To me, is using multiple mode of communication, but I would say that the tone, I'm repeating myself, but the tone needs to be really unique and different. This is not, you know, yeah.
We have another question. So first, and ask for just a basic information. So can Dr. Adan tell us again her official job and role at UH? And also, did she seek out communications to support these great efforts, or did the organization ask her to address this?
Cool, yes. So my day job is to be the director of what's called the Connor Integrative Health Network. That is a system-wide program where we integrated non-pharmacological modalities within our Center of Excellence and Institute. Modalities that are evidence-based. So I'm talking about acupuncture, meditation, yoga, chiropractic care, and we have some physicians and consultation as well. So that is my day job. Our focus is to enhance clinical outcome and partner with our physicians, as well as improve patient experience and impact actually provider experience. Now, my also passion is the wellness and well-being of employee. We talk about burnout for physicians and nurses and clinical and clinicians, and it has certainly been something that I'm very concerned about, passionate about. It really saddened me, as people put so much effort in that, going into that profession, and then end up to be hurting. So I felt like I had certainly the skill set to address that issue. I was asked by the head of HR and our CEO to come up with something and, build a team that was extremely effective. And within a few days, we were able to have a plan and execute. And we were very lucky because it obviously took a team effort. We have communication is on deck and helping us literally every day with sending the email, writing the email. They build this digital library of resources. We work with IT, and because we had to create a call center and emails, and this was done literally in 24 hours. We were very lucky to have outstanding support and appreciation for what we did. And then in our case, we also had people who were qualified to do those meditation class, yoga class, and so forth. So that was an opportunity for people to continue their work, especially at the beginning where we were in, lockdown, basically.
Yeah. You mentioned the ask of you to develop an extremely effective program, which has been great to hear about. We have a question. How do you measure the effectiveness of your employee and internal communications?
So we keep track of, opening rate of emails. We keep track of attendance of those classes. We keep track of the call center and the usage of the crisis intervention team and refer to EAP and behavioral health. For now, this is what we do. The services that we do independently of COVID, we have an evaluation that we keep track more closely on benefits on stress, pain, anxiety, and getting also next year to looking at retention and engagement. But that's independently of COVID. Those are the services that we have done pre-COVID.
Got it. Yeah, just overall employee engagement and communications. So we have an ask about, do you have a reward and recognition program in place to highlight and showcase employees? If yes, can you describe it? And our health system uses one to keep up morale. And I'm curious about how others do this.
So we have different set of rewards or awards. I'm going to say we have now a weekly email coming from our new CEO describing heroes. And so those are people who are interviewed and, doing really well, whatever they do clinically or administratively, usually part of a team, and they are highlighted. And it's also kind of a genuine communication. You feel like you're getting to know them by just this brief interview that they have. And it's called, or UH Heroes. And I think that people have really liked that, again, knowing that we all, this team spirit, right? We all in this together, and it's having a good sense of what other people are doing and celebrating success. In terms of, we have incentives. So the classes that I'm talking about, people actually get points, which actually means cash, to attend them. And yeah, that's been certainly appreciated. It's significant. I mean, there is a maximum per quarter, but it can add up significantly to, you know, I think $700 or $800 a year. So it's certainly something that is significant.
And we have one last question, because it's clear that what you've shared has been so helpful to everyone on the line. Would you be willing to share samples of your internal communications with participants? Maybe provide a link or email with a few best examples. So if you were willing, Jalissa can you know, find a way to field that out for us. But it's so important to share these best practices. So wondering, you know, if a few of the emails that you talked about, you know, we could publicly share.
Sure. I think that I'm going to say one more thing about something that we didn't talk about, is how important it's to engage your community, your external community. And we have been blessed by outstanding support from, you know, Cleveland. Very generous outpouring of love, care, support, from free laundry service to Bleep, you know, flying above our hospitals, to the Rock Hall, sending a van of music and free food, and on and on and on. And, you know, that we, again, when we have shared that with our employees to this daily email, and it has what our employees are sharing with us is what they like the most is this appreciation and sense of gratitude from the community. So the role of the community has been essential, and you know, certainly less present now as we are entering into a different mode, and themselves are probably you know, try to adapt and come to a no normal state as well. But that partnership has been very important. And historically, we are certainly very active in fundraising. And we have found that our generous donors have been very interested in supporting our employees. So that initiative, the UH4U, has generated some fundraising activities as well. And then lastly, when I talk about engaging the community, you know, as we are looking at how we can support our employees, could this also be something that we actually help other employers, non-healthcare employers, to do? You know, could potentially be a way to increase our visibility as well as a potential source of revenue.
Got it. I think that's a really important connection, is, you know, the community, and we've seen so many communities out there being so grateful, appreciative, and just cheering on frontline workers and those in the health systems, but using a program that provides employee support to amplify and make sure that we can maximize the reach of everyone who knows how many people are rallying around them and caring is so important. I think the second theme that I heard was just vulnerability and modeling, and that it's just so important, because that could be the difference between offering something that truly helps someone and having them access it. And then also just the very important act of listening and seeking to understand first before we assume or, you know, make any kinds of undrawn conclusions about where employees could need help as we navigate the new normal. So Dr. Adan, this was so helpful, and it was amazing to hear from you. Thank you to Jalissa for helping out with today's show. Please let us know if there's something like us to cover, shoot us an email at nonormal@thinkrevivehealth.com and visit our website for this to access this podcast as well as other versions or other episodes. So thank you, Dr. Adan, so much.
Oh, it was my pleasure. Thank you so much. Have a great afternoon.
Yes, thank you.